join us through Zoom or Facebook Live. I just want to say good morning and welcome to this webinar. It is being co-hosted by Flourish St. Louis and the NAACP St. Louis County branch. As you all know, the title is Conversations to Create Real Systems Change, Black Babies and Their Mommies Matter. My name is Monique Norfolk, and I, along with Renea Lester, co-chair the Regional Impact and Improvement Team for Flourish. Generate Health is a maternal and child health coalition, and Generate Health's mission is to mobilize the region to advance racial equity and pregnancy outcomes, family well-being, and community health. So what's Flourish? Flourish St. Louis is an initiative under Generate Health that was formed because we do have a crisis in our region. Our infant mortality rate is one of the worst in the United States, and Black babies are 3 times more likely to die than white babies. It's important to note that this is not just a health problem. Issues like systemic racism, poverty, and access to health services are what inhibit Black families' ability to flourish. And so our region's transportation, housing, employers, schools, and social services all need to be part of the solution. Flourish has been bringing community members impacted by racial inequities together in key sectors since 2015. These include healthcare, nonprofits, business education, and also we've brought many community members that aren't necessarily in the health profession field or business field together to also solve this work. There's so much work that still has to be done, and we thrive on bringing our community together because we know that without your voice, we can't truly affect change. And we know it's time to take an even more significant step of action towards truly moving this needle forward because far too many Black moms and babies are dying. Our North Star is achieving 0 racial disparities in infant mortality by 2033. And we are looking forward to hearing from our panelists as we get started with this, this movement, which is like the next phase of Flourish's very hard work in our community. We are thankful to be partnering with the NAACP St. Louis County branch. And so before we introduce our esteemed panelists, I would like to ask Mr. Charlie Dooley to speak on behalf of the NAACP.
Well, good morning to all of you. I'm extremely happy this morning to represent our president, John Bowman. I serve on the executive board of the St. Louis County chapter. It gives me great pleasure and extremely excited about this collaboration with Flourish STL. It is a great morning. A lot of good things going to happen this morning. And we're going to talk about something that's extremely important to all of us in the St. Louis metropolitan area. We'll be discussing infant mortality rates of Black babies. And we are extremely happy to be with you this morning. And we have a distinguished panel, and they're going to share great opportunities for us and valuable information. But that being said, we have 2 great moderators, Renea Lester and Monique Norfolk. Monique, it's on you.
Thank you, thank you. I would like to ask my wonderful co-chair if she would to go ahead and share a little more about our panelists that are joining today.
Absolutely. And before we do that, we are going to go over some house rules before we should go over before we share the bios of our panelists. So the first house rule is to be engaged. Look, your voice matters out there. We need each and every one of you to know that not only do we want to hear from you, we really need to hear from you. As you heard Monique say earlier, we have some of the worst mortality rates in the country, which is just not what St. Louis is about. We are a tight-knit community, and we want to do better. If you want to raise your hand, you will be unmuted to ask questions. This will probably typically be later in the second half of our discussion today, where you'll be able to really dig in and just maybe even point out any blind spots that you may have seen in our conversations with the panelists or additional questions that you may want to ask. You can ask questions and comment in the chat box and on Facebook Live throughout the event. As the panelists are speaking, we will be paying attention, and we will do our best to get to as many questions as we possibly can in this hour and 15 minutes that we have with you guys. If we're not able to get to all your questions, we will get them answered. I want you to also take note that there will be a survey after this is over. And we really need you to fill it out because all of the information will be used as data moving forward. to help us really make a real impact, right, for real changes in our system moving forward. So let's get to our wonderful panelists that we have. Just taking a look at their bios, it was like, how do you annotate such greatness from each one of them? So I'll start with Reverend Dr. Starsky Wilson. So the Reverend Starsky D. Wilson is the president and CEO of Deaconess Foundation, a faith-based grant-making organization devoted to making child well-being a civic priority in the St. Louis region. He is also the chair of the National Committee for Responsive Philanthropy. Wilson led the Ferguson Commission after the death of Michael Brown Jr. In 2015, the Ferguson Commission released Forward Through Ferguson, A Path Through Racial Equity, which called into action changes in policy, the courts, child well-being, and economic mobility in effective organizations. In 2019, Wilson received the Legacy Award at Annie Malone's second annual Legacy Gala by pursuing God's vision of a community marked by justice, peace, and love. Starsky earned a Bachelor's of Arts in Political Science from Xavier University of Louisiana, a Master's of Divinity from Eden Theological Seminary, and received the Doctor of Ministry degree from Duke University's Divinity School. So thank you to the Reverend Dr. Starsky Wilson, who is awesome. And next to the second awesome person, Dr. Kendra Holmes. Dr. Kendra Holmes is a St. Louis native and graduate of the St. Louis College of Pharmacy. She currently serves as a vice president, chief operating officer for Effany Healthcare, formerly known as Grace Hill Healthcare Centers. In July of 2015, she was named vice president and chief operating officer. Dr. Holmes received the St. Louis College of Pharmacy Distinguished African American Alumni Award in 2013. Dr. Holmes was a member of the 2015 St. Louis Business Journal's 40 Under 40 class and received the St. Louis American Foundation's Excellence in Healthcare Award in 2016. Dr. Holmes also serves on the board of Health Works Museum, in which its mission is to inspire children to make positive health choices. Dr. Holmes has a passion for improving the lives of underserved populations. Sorry about that. She has extended her efforts with the St. Louis County NAACP, which include most recently their discussion on the impact of COVID-19 in Black communities. As part of the St. Louis County Prosecutor Wesley Bell's transition team, Dr. Holmes leads the diversion and treatment initiatives. Due to making such a significant impact in her community and company, Dr. Holmes was selected by the St. Louis Business Journal as a member of the 2019 Most Influential Business Women. Thank you so much to our wonderful panelists. And that was the annotated version of their biography. So imagine what the real ones look like moving forward. Welcome, both of you. So we can jump right into our first question.
Actually, as we get started, I just want to also congratulate Dr. Holmes on her recent success as being promoted to Senior Vice President and Chief Operating Officer at Effany. We are super excited about that. And we want to let you guys know that we are recording this. So as we step into the question section, we just want everyone to know that this is being recorded so that we can go back and really listen to the responses that we've received, look at the questions and the suggestions that have been offered through the chat box and all of that, and make sure that we use that information to move us forward. So we're really excited to hear from all of you. I'll start with question 1. So question 1, can you identify significant organizations, institutions, and or individuals in the St. Louis region that should be donating to the issue of Black infant mortality, and where would these dollars be most impactful? We will start with you, Dr. Holmes.
So who should be donating? Everyone should be donating. Basically, all the major hospital systems, we need to have state and local funding towards this initiative. And where would the dollars be most impactful? Oh, I could talk about that for a long time, but access to healthcare is a huge issue. So, we were lucky. We were actually fortunate to get Medicaid expanded. Just kudos for those efforts. Access to healthcare, not only just healthcare, but access to quality, accessible healthcare needs to be a priority for these funding efforts. And looking at the socioeconomic issues, of course, the poverty that many individuals live in North St. Louis County, and throughout this region. So a focus on not only the socioeconomic issues, but also education, funding for the schools, proper health education as well is definitely fundamental. And one thing that always sticks out is transportation. If you don't have access to get to your provider, if you don't have access to take your child to get their shots or their immunizations, that's not going to happen. And there's always a lot of talk about, people and their priorities. Why don't you go to your prenatal classes? But there's a lot more behind that than someone just making a decision of, I'm just not going to go to my prenatal classes. I just want to say that Black mothers care about their babies just as much as any mother cares about their babies.
Thank you. Dr. Wilson.
So first I'll say amen. Add my thanks for the opportunity and the invitation to be a part of the conversation. Appreciating what Dr. Holmes has said, I want to echo that and also say that we've got to remember when we start talking about Medicaid expansion, the millions of dollars that we will get each year because of that happen because there was deep investment in grassroots efforts in order to make that possible. Let us recall, we have been for 15 to nearly 20 years working on expanding Medicaid and or transforming, depending on which side of the aisle you listen to, Medicaid in this state for years. We've had the endorsement of our largest philanthropies in the state for over a decade. We have had the endorsement of the Chambers of Commerce for well over a decade, and we've had the hospitals working on it at some level for at least the last 8 years. It was not until we got deep investment into grassroots organizing across the state and built capacity to knock doors, to invest in organizations like Action St. Louis, who knocked more than 36,000 doors in the city of St. Louis, that we got the margins to get to Medicaid expansion. So I just want to add to this, because we're asking about who should be contributing and funding, we should remember that the state, so that's local government, federal government, or state government, is the largest payer for all social services and will always be eclipsed by more than 10 times, eclipse independent philanthropy. So while yes, the hospitals should be giving, they should be redeploying DISH funds to support this. Yes, independent philanthropies like Deaconess Foundation should be investing in this. Yes, corporations should be investing. They should return to a charitable model rather than a corporate social investment model. They don't think they get returns on Black mamas and babies. So the large corporations in this community do not give to initiatives for Black mamas and little babies because they don't think the little babies buy their product. And since they're not interested primarily in charity, but they're primarily interested in where they're going to get a return, they tend not to invest in this area. So all of us should be gathered around this table. Now, the other thing I'll say about this, and I know we'll get to some of this in a minute, is that we should be investing in spaces that are led by the people who are impacted by these issues. So what I'm saying very clearly and without reservation is Black mamas led organizations should be leading the work and should be getting the investments for work for Black mamas. So if we find, because we don't get to segment ourselves, let us be clear, I'm a Black father every single day. I show up as a father of these 4 children every single day. And whether I'm the president and CEO of Deaconess Foundation or the pastor of St. John's, I bring being their father with me. And so if you get to opt out of this work at 5:30, then you can't lead it. And so Black organizations that are led by these Black mothers should be invested in. So here I'm talking about, yes, I'm talking about indeed the FQACs, the federally qualified health centers. Yes, I'm also saying we are blessed in this community to have 2 intermediaries related to community health in the Regional Health Commission and in the St. Louis Integrated Health Network to be led by Black women. Their work should be deeply invested in to coordinate the rest of the work. The FQHCs, absolutely. And also the independent centers like JAMA Birth Village and the organizers like Action St. Louis, all organizations led by Black women, make Black women's health and their children's health a more palpable, positive reality in our community. And so these are the places we got to invest in. One of the things we got to look for is where are Black women leading in the first place.
Wow, that's my fellow Xavier, right? I just want to say that. He's married to a wonderful Delta, who's very important to me. I am like, wow, you all gave us some great information and hit the nail on the head. Thank you so much for that. I'm just ecstatic that we're having a real conversation. We're not sugarcoating anything because that's not what's needed. And so I just thank you all for being fully transparent and agree with everything you said. I would like to turn the second question over to my co-chair.
All right. So let's pull up the second question. And there we go. So to our wonderful panelists, when we think about engaging Black mothers' voices, what will it take for them to have a seat at the table, making decisions that affect their health and well-being? How do we get the voices of those who are being served by our healthcare system? How do we get their voices at the table? What would it take for those at the table to engage and invest in their voices as well? So yes, please, I'll start with, I'm gonna throw it to Dr. Starsky Wilson for this one to start off with.
Yeah, so I mean, I truly believe this, right? The hand that rocks the cradle rules the world. And so when we think about that, we got to think about what's the real workforce in healthcare. And the real workforce in healthcare is nurses. So I'm really pleased. The Deaconess Heritage is a heritage of the consecration of an order of women to learn nursing and theological preparation in order to serve the infirmed in communities. Reaching into that heritage, we continue to support a nursing scholarship for students from St. Louis, from underserved communities, partnering with the St. Louis American and others to target Black and Brown communities to recruit and develop nurses. Because quite frankly, when we start talking about disparities in healthcare, which I'm sure we'll get into very clearly, we got to reflect that when you walk into any of our major hospitals in this city and in our region, you see a largely white female workforce of nurses. And we can talk about docs and all that kind of stuff. That's really important, but the majority of the employees are nurses. So I think first and foremost, we have to impact that pipeline by investing, preparing, sending forth, scholarshiping, and supporting Black and Brown nursing students and professionals at other levels. I will defer to Dr. Holmes as it relates to the remarkable legacy of Black pharmacists and others in this community. But I think we got to do that. The other thing we got to do is we really do have to press in leadership the health system, which is the largest employers in our region, to do better as it relates to their outreach efforts and as it relates to their leadership teams. And so we have, I sit on the board of one of our hospitals. I have operated in some of our councils that bring the hospitals together. And we do not have leadership in the hospital systems that reflects the communities. And when we find people of color in those leadership roles, they tend to be in support roles, even if they are lead roles. So yeah, I'm glad you got a vice president of HR. I'm glad you got a vice president of communication and outreach. I'm glad you got an IT officer who's a Black person. I need some hospital presidents. I need some system presidents. I need some core business unit strategists to be people of color. And that's something that we lack in this community. And that is going to require pressure, soft pressure and hard pressure on these systems. And it will require transitions and vocal leadership for our communities from Black trustees on these boards. There's always a few of us who sit on these hospital boards. If we're willing to sit there and say nothing about the senior team and leadership teams that only have Black people in subordinated roles, then we're going to get what we get. And it's going to be, like Michelle said, it is what it is until we say something about it, right?
Yes, thank you. Thank you so much, because I actually have a follow-up question, but I want Dr. Holmes to speak to that question as well. And I'm going to ask the follow-up question.
Sure. So definitely agree with everything that Starsky said. And I just want to be clear, and this is, sometimes people don't want to hear this, but Black people generally do better when they are seen by Black providers. There's significant data that shows that, as far as pediatrics, adult medicine, Black patients do better. They have better outcomes when they have Black providers. So to get that seat at the table, we need to produce more Black healthcare workers. And again, not just the support staff. We need Black OBGYNs. We need Black family practice physicians. So there needs to be a focus educationally on building that new pipeline of Black providers, because absolutely we do better. As far as the seat at the table, it's often difficult when you have that seat at the table, but when you have that seat at the table and you're a Black person, you need to make sure that you're advocating for Black people. So don't just sit at the table and just continue to eat and benefit for yourself. You're there, you have a responsibility to not only advocate for Black people, but to bring as many Black people to that table as possible. And leadership really needs to understand that. It's absolutely not about me. It's about how many more Kendras that I can bring to the table. And I think if we collectively understand that, we will do better. I do realize that often there's a lot of microaggressions that we face on a daily basis. I face them on a daily basis. But my vision is laser focused for the community. And we have to make that obligation and that commitment to bring more Black representation to leadership.
Thank you so much, Dr. Holmes. And from both of you, it looks like you're saying a lot of what's going to change the system is actually the educational piece of educating those that can work as nurses and doctors and healthcare administrators in the system. Am I kind of hearing you both correctly as far as that creating that pipeline moving forward?
Yeah, I would agree that it's creating that new pipeline, but it's also educating the non-Black providers on implicit bias, on cultural competency, and unfortunately on valuing Black people. And then that's something that you would hope that you don't have to teach, but it's absolutely something that you have to enforce when these issues with Black mothers are not just for poor mothers. I'm a Black woman, I have a doctorate, I have a great salary, and I'm still 4 times more likely to die during childbirth than a teenage white mother in rural Missouri. So it's not just about, socioeconomics or education. It's also a lack of value for Black people in general.
That's phenomenal. So I have a question from someone. They said they have been employed at St. Louis Children's for 20 years and have heard the talks of DEI, right? All the time. We hear the buzzwords, but they feel like you can't legislate change of heart. So what is being done collaboratively to educate our hospital to change the culture of their staff and their administration?
Yeah, so I'll agree that you can't legislate the change of hearts. I also will say that that's largely not been our strategy, that for progress for Black people in America. And I'm going to speak for myself and get in my I voice. In the interest of full disclosure, I am a trustee of St. Louis Children's Hospitals on this question. But I'll speak for myself, speaking my I voice. Number one, I really don't care how you feel about it. I care more about whether your feelings can impact my life, my livelihood, my family, right? And so what legislation can impact is whether you can rightfully impact my life, my livelihood, and my capacity to care for my family. And what we have found is once you constrain behavior and you put people in situations where they're exposed to diversity, then over time, hearts actually do change. It's one of the reasons why one of the indicators of acceptance to diversity is degree of education. Because the academic environment on undergraduate campuses is some of the most diverse settings that people ever find themselves in. And once they actually traverse that, they find themselves open to different kinds of people. So I actually do believe that some legislation is helpful in this regard. And I believe over time, the impact of that legislation has the capacity to change minds and hearts.
I love that. Thank you so much. And I wanted to also ask, Starcy, that was wonderful. I wanted to ask too, in response to what was just shared about like being engaged as Black moms, like if we're at the table, we need to obviously, you know, because I'm at tables too where I'm the Black person speaking up all the time. That's invaluable. It's uncomfortable sometimes, but it's what we got to do. We are charged with that. I guess what I'm wondering is, how do we get more of us at the table? Because that's the problem, is that there aren't enough of us at the table. And it doesn't have to be those of us that have all of this educational background. It's that lived experience that's really valuable. How do we get them to that table, you know, at those higher levels where they are making the decisions for these systems?
So I'll take that one. So I think it starts not even, you know, at the corporate level. It starts, you know, when we're mentoring children and we're reaching out to, you know, young Black men and young Black women. So just being that positive role model to children who often may not have a positive role model. I think that is a fundamental piece as well. But as far as the corporate level, you know, we often talk about, I hear this a lot in St. Louis, this whole, you know, crabs in a barrel mentality that often occurs. And, you know, when there are limited resources and there are limited opportunities for Black people, it often becomes a very competitive atmosphere, which unfortunately often the corporate culture really perpetuates that. I think we need to get outside of that and realize that collectively, the goal is for us to succeed collectively. You know, again, it's not just about me, or it's not just about Starsky, it's about this community. It's about Black mothers and Black babies, you know, thriving and living. It's about a bigger picture. So, you know, we really need to start just, you know, that mentoring. And, you know, I see individuals who are nurses, and, you know, I just try to provide them opportunities to explore different opportunities in management and leadership, because I can't do it all by myself, right? Like I can't affect all of this change by myself. So I need as many Black leaders, as many white advocates supporting this initiative for us all to be successful.
Yeah, I think I agree with that. I've got, you know, I'm a preacher, so I think in 3 points to the poem. So in alliteration. So the 3 pieces for me, talent, training, and tenure. The most challenging is going to be tenure. First and foremost, Black excellence is in full supply. It is in robust supply. So Dr. Kenninger Holmes is remarkable. Dr. LaToya Wilson, my wife, is remarkable. Dr. Steve Player is remarkable. All people that I know and look up to, not because they're so generous that they hang out with, you know, a slob like me, but rather because Black excellence is all over the place, right? You can't throw a rock without getting to enough talent. There's plenty of talent in the pipeline. The best program at the COP, Xavier University producing Black medical students every year. Like, there's full talent. Now, are we investing in training is part of the question, right? So does that best program at the College of Pharmacy have all the resources that it needs to produce and support Black pharmacists in the way that they want to? And are philanthropic dollars going into that training and support? Are we doing the kind of mentoring that Dr. Holmes speaks about for young people before they get into this place? So I'll spend my time saying that, and then landing on this issue of tenure. Some of the reasons why it ends up being the same ones of us is because we stay too long. I've got this issue. My whole sermon on the prodigal son is he left too soon, he went too far, and he stayed too long. some of us sit in seats representing the Black community for too long, and thus we outlive our service capacity. We outlive our usefulness to the community because we are more comfortable in those seats, in these seats, than we are with our community. And so we need to get to a point where we put a time limit on our service in some of these boards and among some of these places that are not built for us. And we need to have some responsibility to use that knowledge to build tables for us. I say it to people in philanthropy all the time. My mentor in philanthropy, one of them, my earliest one, said, these are jobs, these CEO jobs, these are jobs that you shouldn't have more than 10 to 12 years. You get too comfortable and you get too far away from the need in the community. And the organization needs new mind, fresh wind, fresh thinking. And so I say that to say, I left my pastorate at 10 years. At the end of this year, I've been a deaconess for 9 years. These are times where we need to put limits on ourselves. And so we get out of the way and allow new people to come in. So I think some of our pressure needs to be on those of us who find ourselves in places of influence to say, you've been there a little too long and you need to move in order to create a way for that professional who got into this business a little bit after you.
Hey, Dr. Starsky, I have a question for you. Do you think, you talk about people moving on, right? That time limit, placing those limits on your tenure at particular places. How do you deal with that? Because we know that a lot of things are motivated by two things, power and money. And so when it comes to those two things and it comes to personal agendas and ego, how do you push that agenda forward as far as, hey, it's time for you to pass, pass the buck, right? Or, transition. How do you do that?
Yeah, I mean, I think a lot of it is rooted in what Dr. Holmes said, which I think is it's just real Black. She said something that was real Black, so I want to point it out again, right? Collective advancement versus individual advancement is real Black. This individualized notion of success is not very Black, and it's not very Christian. And I'm a Christian, so that matters to me. This idea of communal salvation is deeply rooted into how Paul talks about it in the New Testament. And this idea of collective advancement is deeply rooted in African cosmology. And so this idea of power then has to be reconstructed. It's not about how much power and influence I've got. It's about how much power and influence we've got. And we experience it when multiples of us have the opportunity to have voice. And so we got to get more humble and get less Western, get more Black in our calculation about power and defer to communal benefit. And I think that's how we get there. It's going to require some re-education and consciousness around that as well.
Super powerful from both of you guys. Thank you so much. We can spend all day on this question. We had a joke. I said, it's going to get so good, we should keep it to like 1 to 2 questions because we probably can go all day. But we will go to question 3.
Yes. I appreciate that. Thank you so much. This has been powerful. This is exactly what we were dreaming of when we thought about this. So thank you all. We need to get more Black. All of these systems need to be more Black. And that's the reality. So I got a question from one of our people have joined us and are participating. And Earl asked, I want to make sure I get it right. How do we account and call into action Black fathers to support the efforts and be a source of energy for transformation? And I thought that was a really great question because Black fathers are a big part of this picture, and they are more involved than other fathers. The research has shown they are the most involved fathers. How do we call them into action in this issue?
So I would say I think that they already are active in this issue. With Affinity Healthcare, we have a great program, our Centering Pregnancy program, which is when you talk about that community, it's basically group prenatal care. So our moms have an opportunity to be with other moms of similar age, similar delivery dates, and just talk about, you know, their issues, their concerns, their health. And we see that that group prenatal care does result in better outcomes. And we include our dads. We have the dads there. They're a part of the process. They're valued. You know, for me, a lot of this goes back to values. So I may say that a couple of times. When people feel valued and supported, they produce. You know, so we need to uplift Black men. We need to, you know, stop this negative discussions about, you know, deadbeat fathers, because when you actually look at it, that's not the truth. You know, the next question is about data, and you know, let's look at the truth and not the perception that the Western culture has created about Black men, because it's not accurate. So again, valuing Black fathers when they come in, you know, as a provider, talking to dad, you know, asking dad, does he have questions? What are his concerns? Because when dad is there and he's a part of the situation, he's going to advocate for mom. So when you're in there and you're a mom and you're pregnant and you have all of these questions, you need an advocate, and your best advocate is going to be that father of the child. So again, just you know, valuing Black men and representing their role, and the importance that they have in Black families.
Thank you. No, that's very helpful. I really appreciate that. And I agree. I'm a mom of a 29-week-old, a child that was born at 29 weeks, and having lost a child. And I can say my husband was fully involved with every aspect of what I needed. And the research shows exactly what you're saying. Our Black fathers are engaged. And I appreciate that. And I don't know if you had something to say, Dr. Wilson, before we move to this third question. I
just co-sign with appreciation.
Awesome. Thank you. Thank you. And so I will move to question 3. And I just want to let everyone know we are seeing the questions in the chat. And so we've asked a few of them. What I think we're going to do at this moment is make sure that we go through the remaining questions, because there were some registrants that also submitted questions. So that kind of added to the list. And then what we're going to do as we move into the community, the more community engagement portion, we will go to these questions first and move from there. So I want you to know that we will address those questions. Question 3 is, how can we, so basically we understand that when we're measuring success, that can be somewhat subjective. And so while there's plenty of data available that lets us know that Black moms and babies are dying at disproportionate rates, we recognize there's this qualitative side of this that actually tells the story. Oftentimes we're just looking at the numbers. We're not looking at, well, how did we get here? And so I'm wondering, how can we more efficiently gather data in real time and utilize this for systems change? So, you know, there's specific settings, as you can see there, that we were focusing on, where there are moms that we know are complaining of experiencing pain or something not feeling right, and they're not getting the support they need, and then as a result, they and/or their babies are dying. How do we get that data in real time? Because I'm not in a hospital setting or doctor setting.
So
I'm going to differ definitely on this one.
You want to go first? You know me? Okay. So federally qualified health centers, we're all about data. We absolutely live data. That's what we have to do. We are required to report our data, you know, on a weekly almost basis to the federal government for our outcomes. But it's about the data, but it's also what you do with the data. Because if I just sit on the data and I know that, you know, my C-section rates are sky high for Black women and my low birth weight, you know, moms are increasing, and I don't do anything to affect change, the data is pointless. So it's what you know, you can be, you know, data rich and outcomes poor. So what we want to be is outcomes rich. We want to use that data to affect change. So I'll just talk a little bit about, you know, what we do at Affinia Healthcare. So we recently did a needs assessment. So we polled the community, we polled our patients, community partners, and more importantly, you know, just our patients and the community. Because providing care that we think is effective is not always effective. So, you know, you have to actually have the voice of the patient to really impact change. So, you know, just looking at, you know, why we had low birth weight babies. Talking to the moms, okay, access to prenatal care. We know access to prenatal care is the #1 factor that can prevent low birth weights. So transportation was an issue. So we work with different partners to try to improve the transportation piece. If moms don't show up for their appointments, we have community health workers who are knocking on their doors saying, Mom, do you need help? So it's that community piece. You know, again, when you're a mom, anyone who's been a mother, you know how stressful it can be. You often feel overwhelmed. And I think we just need to act more as a community to help moms and to get better outcomes. But it's really what you do with the data.
I appreciate
That's
that.
pretty powerful.
I'm sorry, go ahead.
I was going to say, to follow up with Dr. Holmes. So when I am a mother of 2 C-sections, right? And my youngest was rushed to the NICU when he was born because he wasn't breathing. And what I noticed is that they have a Black father. My husband was there, and he's a very assertive, has a very assertive presence. But I noticed that some of the white caretakers when I was in the hospital did not really respect or advocate. We had to advocate for our son while he's in the NICU because they didn't believe how present we were. How did we change these assumptions? Like, that's real information in real time. I know that you're treating me a certain way. Like you said, Dr. Holmes, educated, right? Both of us are educated Black people, and we're being treated differently. And, our son can't breathe and we're checking on him. They're saying things are fine while his machines are going off, right? And so how do you reconcile that? How do we get our community, Black, white, to all see these type of things happen and advocate for the patients, the mother and the child, while they're in the hospital?
And that, I want to jump in just because this is one of our registrants did submit a question that is aligned with that. I think that's really powerful, Renee, and I had a similar experience for our 2 months that our daughter was in the NICU. But this registrant says, as a member of the social work department at St. Louis Children's Hospital, how can we support moms coming into the hospital and promote a safe, comforting, and secure environment? And that's really powerful because we understand that people are scared to speak up when it comes to their care because they're scared of how it will impact their care. They're speaking up and they're not being heard. So then what do we need to put in place to make sure of this? We've thought of things like, do we have doulas at every, anytime a Black mom is there? Is there an advocate in the healthcare system that needs to be there anytime a Black mom is there? Is there an anonymous way to be able to gather this information in real time so that if mom's not being listened to or heard, somebody shows up and makes it happen? Like how can we make sure they have this experience?
So I'll just say one thing, that how they could make it different is if they treated us like they treat everyone else. So, that would be a great start if you value Black women like you value white women in other cultures. That's a great starting point right there. But it would be great to also have additional resources for mothers prior to that piece. Prior to you having to even go to the hospital, if more support and resources were available, let's prevent the hospitalization. But once you get there, value my input and value my perspective about my child and my body. And, again, treat me like you would treat a white woman, basically.
Yeah. So just a couple of pieces I want to affirm and riff on. Expanding our thinking about the environment of care is critically important. So when we start talking about, Dr. Holmes mentions the care that's provided before you get there. So the affirmation and the uplift in our community of community health workers, doulas, and midwives is critical for us to understand care for marginalized communities broadly, for Black and Brown communities specifically. So it's one thing when we think about care, we're thinking about doctors and nurses. It's another thing for us to affirm that care begins in community, and we need to be thoughtful about resourcing community health workers as a strategy. Quite frankly, in this moment, It's really important for us to learn the lessons of Prepare STL, learn the lessons of the Integrated Health Network, learn the lessons of this partnership that is saving lives and has been right now for us, that's a community health worker strategy, right? That's in a health pandemic. Let's learn that lesson. I'll go Bible again and say it was the midwives, the mamas and the sisters that saved Moses, right? So save a whole people with midwives, right? So care and community, we see this in our current context. So let's expand our thinking and let's resource these solutions that we know are there for us, caring for people when they come. The other piece is I just don't, Dr. Holmes has better faith than me. I know she's a good, faithful church-going person. And so I don't know that you're ever going to treat me the way you treat a white man or treat my wife the way you treat a white woman. And so I got to say, what I need you to do is have her to be met by a Black woman when she gets there. So the transformation of the actual workforce in hospital and medical professional settings is absolutely critical to the elimination of disparities in infant mortality and other health disparities in our community. So if you are not willing as a system to hire Black and brown providers, do not expect that you will eliminate the gaps in health equity in your setting. Because John Powell, who does work on implicit and unconscious bias, suggests that our subconscious acts and reacts and processes information so much more quickly than our consciousness that it is almost folly to speak of consciousness. We are always making meaning. And before your training kicks in from your DEI session that you didn't have enough time with, your whiteness kicks in, your privilege kicks in, the normalcy of your existence in America and Western culture kicks in. And so until we get to that point, what I need you to do is to round out the environment and to build a healthcare workforce that looks like the community, because the subconscious of the Black women who meet the Black women when they come into that unit will kick in to care for them in the same way that white providers kick in to identify with white patients. It happens subconsciously. And so the only thing you can do as a system to care for this is to transform your workforce to make sure that it reflects the people that you actually serve.
Can I just follow up on that? And I am a very hopeful, optimistic person, Starsky. But I'm also a pretty persistent person. And until that occurs, I need them to treat Black women as they treat everyone else. And I think that part of it is calling it out, because it's uncomfortable for someone. And when a mom is treated poorly and it's because of her color, it needs to be called out.
True that.
That's powerful. That's powerful. I love that. And I saw that Alicia put in the comments that we also need to consider our community health workers as invaluable, people that are here from our community, for our community, and can really be a tremendous support for our moms. So I appreciate that. And I know we're looking at time and all that. We are people who adjust to the needs of our community. And so we're going to still go through our next two questions. However, I'd like to ask, I know you all were going to stay on anyway. I think what I'd like to ask is that we're able to ask the questions as we move in the community portion of this, even more engaged. And it was supposed to just be focused solely on a different space. But I think that as these questions are coming in, if we can ask those, that would be wonderful, and get your insight and input on that. It sounds like that's what people are really wanting. So if I have your blessing, we will go through 4. Okay, cool. We'll go through 4 and 5, and then we will make sure we respond to our community members. Okay, Renea, you're up.
All right, let's look at question number 4. All right, so just so you kind of get a little bit of background on exactly what I'm asking you with this particular question, I am just pulling up my prompt. Okay, so question 4. Okay, so we know that in our community, I'm so sorry, wrong question. see here.
Do you want me to read the prompt?
Yeah, read the prompt because I can't find it.
It's all good. So we're team. Black health professionals routinely see different outcomes, as we discussed earlier. So we started kind of talking about that earlier on. When they see different outcomes among their Black patients when compared to their white colleagues. And so this question is specifically based on that.
So why do you think this is occurring? And how do you think, or do you think this approach can be taken by other non-Black healthcare providers to ensure that as many Black moms and babies' voices are being heard and they are receiving the best quality healthcare possible? So, do you need us to kind of read the prompt again?
No, I think our part of the question is the best quality healthcare. How can we assure that non-Black healthcare providers are providing the best quality healthcare? I think you need to tie outcomes to compensation. You need to look at, we're moving towards value-based healthcare, in America as well. So you need to, it has to be an incentive for you to produce good outcomes for Blacks as well as whites. So that's something that you need to look at as well. And again, cultural competency. You can't teach humanity sometimes, and that's to me what it comes down to. This is about humanity and just having consideration and care for everyone. And I think also evaluating providers based on that. What are your patient satisfaction scores looking like? What is the voice of these Black patients? What are they saying that is occurring in these health centers, and actually following up and making actions based on what's occurring? Because I think a lot of times it's just swept under the rug. It's just, considered as someone's complaining or the patient didn't do what they were supposed to do, when ultimately in a lot of these situations, it is simply racism.
I appreciate the point on accountability. Clearly, Dr. Holmes is the professional on point here. I would also note broadly, just considering this reality of health inequities as part of your professional obligation. So you hear it on the accountability side, but I'll just talk about it on the continuing education side, that this isn't something that should be forced, quite frankly. This is the reality of what we experience. If we experience apartheid-like inequities in our community, because it relates to life circumstances and public policy, then as a provider, you should see it as your responsibility to continue to educate yourself as a professional to reduce those. So I don't know that it's something that should have to be, yes, it is something that folks should be held accountable to, and it's something that the system shouldn't have to do. Quite frankly, you're a professional, you're interested in the community's health. This should be a part of your plan for continuing development for yourself in order to do your job well. And so I just think professionals should be called to that.
I love that. And thank you both so much. And that actually, I think, speaks to what a registrant asked under the same topic, which was discussing the statistic. They recently heard about Black babies' mortality rates dropping when their doctor is Black, because they felt like this is really important for white people to know. Like, that's a fact. And so it seems like that aligns with what you all are sharing. I don't know if there's any need to, say anything more about it. If you do have something, I welcome it. But yeah, she just felt like this is something that white people needed to know. That is an issue. We are also going to move to question 5. And so I think part of this you all have already answered, and so I'm not going to necessarily ask you to answer maybe the second portion unless you have something additional. But we know that in our community, infant mortality is disproportionately impacting Black families, which is why we're having the conversation. However, we also know that it takes all of us to move the needle, not just Black people. And so one thing that has been so powerful, I know Serena Muhammad was really impactful a couple years ago bringing this to our attention. It's like, you know, allies. We have these allies in our community. And so we want to know who have been the greatest allies in your experience and how do we engage them at greater levels. So maybe it's not funding, but maybe it's, otherwise. I think we already talked about some things with systemic change, how things need to occur, but how can we engage them at other levels, and who have they been? Dr. Wilson, I'll start with you.
Sure. I really want to appreciate the work of Generate Health, quite frankly, the Flourish Initiative and otherwise. And I want to talk about a specific way that I think Generate Health brings value. I don't know if they would consider themselves an ally, and Generate Health is right in the middle of this work. But I want to talk about this kind of embedded approach of community organizing that people don't think about when they think about this coalition, formerly the Maternal Child and Family Health Coalition, right? That, Laura Gully and her team at Generate Health have been trained and train others in the community organizing and family issues organizing model. So what does it mean to take the people who are directly impacted and affected, talk to them about and have a curriculum built with them about their own agency and what they desire, and to put them on purpose and on point. And taking that approach has led to issues that we may directly speak to in the infant mortality conversation and things that come adjacent to it. So I tell people in some circles, the whole conversation we had about Clinton Peabody a few years ago that's led to remarkable transformation in the affordable housing space in St. Louis, and the Housing Commission started with mamas organized by Generate Health, looking at the conditions in their own community, right? And so these health conditions matter. And so I'd like to speak to that experience with Generate Health primarily as a partner, again, full disclosure, Deaconess Foundation, but also to say that there are things that are embedded in other types of allied strategies that we may not always see directly in the conversation around health, healthcare, health delivery systems that need to be brought to bear in this conversation as well. And of course, in that, I want to name Missouri Foundation for Health for their deep investment in the Flourish Initiative and their approach to it, and more recent deep investment in Prepare STL, that again, community health worker strategy, community healing strategy of their resources, because they've both been remarkable allies in this work and bringing broad attention to it at the community level.
Dr. Holmes.
Yeah, I would just echo Generate Health, Missouri Foundation for Health as well. IHN definitely have been instrumental in getting change out for moms and babies. I'd also have to say just the federally qualified health centers, and shameless plug, but not just Affinity Healthcare, but all of the federally qualified health centers. We are doing a lot of the work for moms, for Black moms and babies. We're in the community. And often, I say this all the time, often moms are more comfortable and they trust fairly qualified health centers more than they do the hospitals and the systems. And there's a reason for that. A lot of our staff look like them, not necessarily all of the providers. We do work on that as well, but there is a welcoming environment where you can see individuals who look like you, who understand you. And I think that fairly qualified health centers have done a great amount of work to help in this arena.
That's awesome. Now, for both, are there any corporate, private partners, companies, corporations that need to start investing in this work that are major parts of the community, the St. Louis community as well, but really need to get a little bit more involved that we just don't consider, your, Blue Cross, your Centene, right, who's in St. Louis and who's dominating. Are those people that we need to make allies? Are there any allies that we're missing that we should engage moving forward?
I mean, corporations determine what's in the interest of their shareholders. So I try to remind people that all the time. That's who they're in the business of redounding a benefit to, a margin to, and wealth to. And so I think they will make their independent calculations. I've given up. I think I've been in St. Louis 20 years. I think St. Louis has deferred too much of the social sector agenda to corporations whose interests are otherwise. And so while it would seem to make sense for folks who are aligned to the healthcare industry in order to make millions of dollars, to bring them into the conversation, and while I think it may make sense for their bottom line for them to invest, I think they do a pretty good job of making themselves rich, and in the interest of making themselves rich, they should make whatever determinations they should for their shareholders and interests. What I will say though is that our largest employers are still the health systems. So they should have a deep interest not only in their health mission, but in the overall robust value and thriving of the community. And they should be making, and quite frankly, some of the largest foundations we have in this community are attached to these health systems when we're just looking at total dollars under management and investment. And so I do think they have a responsibility to appropriately use those charitable dollars that they are receiving in this community on this issue. And they also, because they are health aligned, they have a responsibility to learn from what the federally qualified health centers are doing and to align their practices to meet what those providers who are to the ground already know and what people like the folks at Jama Birth Village already know. So there's a responsibility to take what's known and to scale it based upon not just their philanthropic dollars, but also the dollars that they deploy in their business models that should be put on point for health as well. They should be taking notes, and quite frankly, they should be engaging in some paid consultancies, because you should just get our work for free with people who are closer to the ground who know this work, like the folks at Affinia and other FQHCs.
I love that. Thank you. And that was really helpful. And I don't know, Dr. Holmes, did you have anything else that you wanted to add before we move to some of the questions that our community members have asked? I know we're getting short on time.
No, we can move on.
Okay. So I am going to pull up these questions and we're going to try to answer as many as possible. But if we don't, like Renee shared at the beginning, if we don't get a chance to answer everything here, we will be compiling responses and making sure we send that out to everyone who has registered. And if we have a survey at the end that we're going to ask everyone to complete. And so if you do that, we're going to have your information and be able to send this out to you as well. One of the questions, which I'll just go ahead and speak to, was asking about how do we get community members engaged in this work. And I just want to let you guys know that we already we already have a lot of community members engaged in this work. Let me say that. There's a community leadership cabinet. Community members have been involved and engaged at all levels. Renee and myself are community members. And so that's happening. However, as a result of this town hall, we're going to be asking questions of you all in that survey of how you'd like to be involved. And so that will allow us to then engage you in the areas where you would like to be involved as well and bring others along with you. So we are planning to take everything from here and really make some moves and next steps. So I wanted to make sure I respond to that. And then this question, I believe it really actually went along with the conversation we had about Black providers and how, their care is actually, is more impactful for our Black patients than non-Black providers. And it says, what's the plan to educate them, those that are non-Black, and to monitor the progress? So what's the plan to educate non-Black providers and make sure we're monitoring that as well, so they can provide the same level of care, because whoever we see should be able to give us the best care regardless of race or ethnicity.
I'll just say that I know that there are efforts at a lot of the medical schools to start doing some cultural competency, implicit bias training for the medical students, and that is occurring. I know at St. Louis College of Pharmacy, we have a great vice president of diversity who's working also with the pharmacy students on cultural competency. So I think that piece is needed, because it's going to take a while for us to develop this pipeline of Black providers and Black nurses. So we have to, we have to deal with what we have at this point, and they need to be culturally competent. And again, they need to treat all patients with the same dignity and respect.
Thank you. Thank you for that, Dr. Holmes. I had a question, and it kind of goes with all of it, but it's from Markeisha. She says, how can higher education institutions be a part of these discussions, data collection, data analysis, and data dissemination? So Markeisha, if you are still out there, I work at UMSL's Community Innovation and Action Center, and that's kind of what we do, all we do. Not all we do, but we do apply data collection, analysis, dissemination, and from that provide support for coalitions and partnerships as well at UMSL. I know UMSL is a big part of that. Washington University and St. Louis University are also great advocates in this community fight as well. That's doing a lot of data collection as well. And I think what we need to do is a better job of getting that data out to the community when we find it. Just wanted to answer that question.
Thank you. That's perfect. I thank you for that. And I do see that there are two different Alicias that have questions, and they are both really powerful. One says, and this is so timely, how do we ensure advocacy for our loved ones during COVID-19 when there are restrictions on who can be in the delivery and waiting rooms? What are our options there?
So I'll take this one. So safety is definitely important. We definitely want to prevent transmission of COVID-19, but mothers need an advocate in the delivery room. So if a hospital has a policy that says that a dad or any type of support system can't be in the room with a mom, we need to adamantly oppose that. A mother needs someone there to serve as her advocate and say, look, this doesn't seem to be going right. So again, and I think that it goes back to that piece of pointing things out that just don't seem right. Sometimes we just kind of let things go. We don't want to cause any issues. And that's kind of how we've been, systematically taught by this society. And, because you never want to seem like the angry Black woman, we'll get called that. And I say, agitate is what I say, for the health of your baby, for your health. If you've got a husband that's gonna, raise his voice a little bit, of course, respectfully, but sometimes that gets things moving, and you have to have that support system there for moms at the most vulnerable times, in their lives.
Thank you. Dr. Wilson, did you have anything you wanted to add to that? I appreciate that, Dr. Holmes.
No, I was kind of sitting with it primarily because we had a health challenge. It was not with a baby, but we had a health challenge in our family just last week, and we were wrestling with whether to take an elder in because we knew she would be alone. She's 90 plus, and we had in the pandemic moment, we'd had to take her in before, and she had to go by herself. And so I just really appreciated Dr. Holmes' reply, but when I heard the question, I was remembering our own experience of the difficulty of that. The one thing I would add is that most of the large systems have an ombudsman, someone who is there with responsibility to take complaints. And so it's not a word we often use, it's slightly archaic. But if in the context of your advocacy, you're not getting anywhere, ask for the hospital's ombudsman so that you can formally lodge that complaint, and it is an opportunity to escalate where those are in place.
I love that. I love that. Yes, I am the queen of utilizing those services, and I get a lot accomplished. So thank you. I see the question. I don't know, Bernay, if you wanted to read the one from Facebook Live that was shared with us.
Absolutely. So another question we have from Facebook Live is a question of really about accountability. So what's the plan to educate non-Black providers and to monitor the progress? How can a person in the community get involved? And I am going to assume they mean get involved as far as holding proper healthcare providers accountable when they do see disparities or discrimination of any sort happening in the health of the baby and the mother.
Yeah, I mean, I think it's helpful. I'll just point back to, I think the suggestions and the approach, quite frankly, that Dr. Holmes spoke to, that she uses for her team, and then also for the recommendation for other providers is really important. It's also helpful for us to remember, in the interest of accountability, that our health systems are nonprofit organizations that operate for public benefit and with the benefit of tax exemption to do public service. And all of them tend to have, because there's not one system for this accountability. There is no community that I know of. There's no community scorecard for providers, if you will, for that kind of direct accountability. But most of these bodies have volunteer boards, advisory boards, so advisory boards that folks could be able, people can access as community members, and volunteer boards that, quite frankly, should be available and accountable. The reason why trustees and directors serve on nonprofit boards is to be the voice of the community. So I would also say to be mindful of who your community representatives are on these boards, and search the website to know who the board members are, and make sure those folks are asking those questions on your behalf.
Thank you. Thank you.
I would just add that everyone has a boss, and fairly qualified health centers and hospitals, they have accrediting bodies. We're accredited by Joint Commission. There are means for you to communicate when you're not receiving quality care. I actually take all of the complaints. I look through all of the complaints because that's an opportunity to improve. And, you know, I utilize that to really judge if we're treating our patients fairly, and what outcomes, and, you know, where are our problem areas. So we really need to have people in those positions that are looking at the quality of an organization that value all people. I mean, that goes back to what Starsky was saying about, you know, it's great that you have an IT person that's Black, but I need you to have, you know, your director of quality improvement that's Black as well. But again, everyone has a boss, and there are means to communicate if you do not receive quality health care.
Thank you. Thank you. I really appreciate that. I think that this conversation has been so amazing, and I'm like, I don't want it to stop. I know we want to respect everyone's time though as well. And so we're gonna, right now what we're doing is we have not gotten to all of the questions. I will be clear on that. We will be answering all of the questions. But I have one more question I want to ask you right now. We are having the survey put into the chat box here on Zoom, and on Facebook Live, they're putting that in there. So while we're wrapping up, if you all would please complete that so that we can reach out to you, we can engage you in the work, we can let you know how things are moving forward. It's a very quick survey. It's, you know, not intended to take a lot, but we really want to make sure we hear from you. So please click on that link that's in there. One question, just because it's been waiting for a long time, I want to make sure I get out, and Alicia's really been so engaged in the work, was how do we recruit those hidden fathers? So she was talking about the fathers that are incarcerated or, you know, otherwise unable to really be present. How do we engage them? I thought that was really interesting.
Yeah, you know, here I'll suggest another partner and ally in the work, and Father Support, well, actually newly renamed Fathers and Family Support Center, and really commend their work, particularly with returning citizens. So they are deeply connected to men who have been impacted by the carceral system, and providing supports to them in the interest of the care for children. And so I just deeply commend partnership with them and their growing work in this as an opportunity as well.
I love that.
I'll just add that, yeah, Fathers and Family Support System Center is awesome. I also look to, you know, the policies and programs to prevent mass incarceration. So I look to Kim Gardner and Wesley Bell's diversion programs. We at Affinia Healthcare have you know, medication-assisted treatment programs for individuals who are dealing with substance abuse, mental illness, to prevent you know, them going in the progression to incarceration. So I think a big piece of that is preventing our dads from being incarcerated.
No doubt of that. I love that the diversion approach is obviously the best one, and absolutely love that. I thank you all so much. I mean, this has been an extremely robust conversation. It's been powerful. We are, again, I want to just make sure everyone knows we are going to answer every question, and we will create a document with responses because we want you all to know that we're hearing you, but we also want you to know you didn't just join the conversation today. And Renee, you know, and we are the co-chairs, and we don't play. So anyone who knows us knows when we say something's about to happen, it's going to happen. So we are affecting change. We have been strategic. Flourish has been strategic in the partnership with NAACP, St. Louis County branch, because of their work in the community and commitment. And so we are all here, and we've been intentional about who we brought to the table because we didn't want just anyone here as part of this conversation. So we want you to know that the work is going to move forward as you have instructed and guided us, as we have heard from Doctors Wilson and Holmes today. And we are going to make sure that you remain informed of what's happening, but you also have every opportunity to be involved because we're not trying to do anything to you. You're a part of our community, and you should be very much engaged in any way that you would like to.
Yes,
I thank you all.
absolutely.
Yes.
Absolutely. So thank you. Like I said before, your voice is needed. Please don't take it lightly to fill out those surveys. But if we're going to get a real change in how this system operates, we need each and every one of you. So thank you so much. Fill the survey out. And if you just haven't had enough and you want more, join us this evening at 6 o'clock. We will be doing this all over again. So
we'll have Dr. Vetta Thompson, who will be joining us. So Dr. Vetta Thompson and Dr. Kendra Holmes on, and I think we're gonna have just like more of this robust discussion and also have a new lens to the table. So definitely rejoin us, whether it's via Zoom or Facebook Live. It's gonna be powerful. John Bowman, who is the president of NAACP St. Louis County branch, will also be joining us. And I thank you again, Mr. Julie, for your joining us today. And do you guys have any parting words? I know we're a little over time, but I would love to give you all an opportunity if you would like.
Just gratitude for the work, grateful for the opportunity to be in conversation with Dr. Holmes. I learned some stuff today. Thank you.
I'll just end with what I always say, that Black mothers care about their babies just as much as any other mom cares about their babies.
Mr. Dooley? Oops, you're muted. Can you unmute for us?
Yes. I have enjoyed the conversations. It was a lot of information, valuable information, but I would suggest to you that do not let our legislators off the hook, Black legislators. I mean, a lot can be done with those individuals to address those issues like the corporations, the institutions in our community. We got Black leaders. We have to hold them accountable, okay? And that's important. They're leaders. If they're not doing the job, get somebody else. But again, do not leave them out of the equation. They are part of this process, and we need to keep them involved and engaged.
Thank you so much. Thank you all. With that, we just want to say we honor and value you. Thank you for your time, your expertise, your voice, and we just can't wait to get to work. So somebody said, let me snatch my wig off. And someone else. And I was like, yes. So everyone has enjoyed this. Thank you guys so much. And I hope that you have a wonderful day. And as Bernea said, please join us at 6. We are so grateful. Thank you. Bye, everyone.